Welcome, EGP learners. We have another health secretary. Therese Coffey is the fourth health secretary we have had in the last 12 months. And as she arrives in her role, there is a full inbox. We've already had her first document, our plan for general practice, not our plan, but Therese's plan, which we looked at in a previous episode. But today we are going to focus on Theresa herself. Have a look at her background and see if there's anything interesting in there that might have some implications for what she does and how she feels and thinks about things as the new health secretary. So let's get cracking. So Gandhi, welcome and welcome EGP learners. How are you feeling about having another health secretary?
Well, as you mentioned, it's the fourth one we've had in the past year. So we've had a lot of focus and change. We have kind of gone into a little bit of depth every time we've had change about a health secretary. So we talked about Sajid Javid when he started. We talked about Steve Barkley briefly. He was in post just for a few weeks and stuff. And obviously Matt Hancock, we talked about way back when. So he was getting close to hitting Jeremy Hunt's, legacy of, length and stuff. But now we've got Therese Coffey taking on the mantle of health secretary. She's also the deputy PM as well. So she's got two hats, two fairly big hats actually to play with. And it's going to be interesting to see how she navigates this forward. Within the first couple of weeks, she's already set out the plan that she has for the NHS in particular called Our Plan for Patients. Again, not our plan, but our plan. And we talked about that, as you mentioned, in the previous episode. So do go check that out. It's a little bit of a longer one, I'm afraid, but we talk about lots of different stuff in there. But today, we're talking about Therese Coffey herself.
Yeah, so a bit of a tradition, isn't it? We've done this for the last few health secretaries. We'll just talk a little bit about her background and just sort of bring you up to speed to her current role, really. Mm-hmm. And as we go through her CV and her past life, we may find some things that are interesting, that might have some implication on what she might do, what she might think as health secretary. And we might talk about that a little bit. Mm-hmm. So that's what to expect over the next few minutes as we talk about Theresa. So I guess Theresa's life began on the 18th of November, 1971. So she's born in Lancashire.
It's going to be her birthday soon.
It is, isn't it? Yeah, happy birthday, Theresa, if you happen to be watching. And then she, in her early life, she went to what I believe are two independent Catholic schools. Mm-hmm. So she's come from a privately educated background, is my understanding. Mm-hmm. Maybe with just bringing up some photos of Theresa, actually, just to set the scene.
Mm-hmm. So as you mentioned, she was born in Lancashire. I believe she then moved to Liverpool, where she's an ardent Liverpool United fan, from what I can remember hearing and stuff. And then subsequent to that, went to Somerville College in Oxford for a year.
Yeah. So and then she moved to University College London and did a chemistry degree and got a PhD in chemistry. Just at Oxford for a year. Do you know anything about that, Gandhi? Have you read anything?
No. So the only information we've got on this is what's on Wikipedia. We haven't delved any deeper to that. And it mentions that she was there for a year. She was part of the union. She was part of the rowing club. And then she was asked to leave for academic reasons. That's all we know.
That's fine. But, we all know from starting university, sometimes you just don't get on somewhere and you move. So we may not need to read too much into that, I think. So after graduating with a PhD in chemistry, she works a number of roles at Mars. So that's the Mars Chocolate Bar Corporation. And they also own a number of drink intellectual properties as well. And she works there as a finance director. Mm-hmm. So I guess that's interesting. Some people might think that could be significant. Mars chocolate, fizzy drinks, not necessarily the healthiest of places to be working.
No, it'd be interesting to know whether that has an impact on her views on obesity and in particular the sugar tax, which is something that keeps coming back repeatedly in terms of, changes to make potentially in terms of helping the health of our population versus the wealth of our population and other aspects and stuff.
Yeah, and then so she continued her what feels like a finance sort of speciality, really. Then she was a finance manager at the BBC, looking at BBC Property Division, and then her career in politics begins. So she was initially involved with the Conservative Party in European parliamentary elections. So in 2004, this is the first time she stood for the southeast of England in a European parliamentary election and was not successful.
I think she came seventh, and they had to be the top four to go through or something like that. And then she went through again for a different location. I can't remember which one, and came 5th, I believe, on that
Yeah,
particular one.
missed out in
Yeah.
2009 again. And then in the 2010 general election, that's when she entered Parliament as the first female MP for Suffolk Coastal, which is her seat. And then she started to become involved in ministerial positions. So 2010 to 2012, she's a member of the Culture, Media and Sport Committee, and then subsequently appointed to be Parliamentary Private Secretary for Michael Fallon, who was working in business and energy at the time. So she's working her way up through her jobs. A government whip in 2014. Interesting. And she was made deputy leader of the House of Commons in 2015. So I think a feature of her career. So I think she's said to be very close to Liz Truss. It was said to be very close to the Boris Johnson sort of agenda that Liz Truss was also quite close to. And I've seen some articles referring to as Liz Truss's right-hand woman in some ways. So she's quite close.
Well, we see that she's now her deputy PM. So
yeah, absolutely. So moving through, so she worked in the Department of Environment, Food and Rural Affairs, and became Secretary of State for Environment and Rural Opportunities. This is 2016. Been on the Environmental Audit Committee, so she's done a lot of environment work, which is good. All of the work's worthwhile, I guess. And then sort of entered the cabinet following Amber Rudd's resignation in 2019 when she was the Department of Work and Pensions Secretary. So that was when she was appointed to replace Amber Rudd, and that was her entry into the Parliament. And then after Theresa May left, it's a bit more complicated than just leaving, wasn't it? But after Theresa May moved out of the PM position, she kept that role at Department of Work and Pensions under the Boris Johnson government
regime.
And that's where she'd stayed until recently. She was campaign manager for Liz Truss in her leadership campaign, both in the parliamentary phase and in the phase where they went out to the party membership. And that essentially brings us up to date, really, wherein Liz Truss has reshuffled. She's been named Secretary of State for Health and Social Care and Deputy Prime Minister.
Which I believe she may be the first person to ever hold both those positions at the same time. I don't recollect any other health minister being a deputy PM.
She is, and she's the first female Deputy Prime Minister as well.
Yeah,
which is interesting. As there's a few comments that I've picked up from places. So apparently she's quite. The Telegraph have described her as the social glue that holds the party together. And and I gather she has a reputation for being very social and enjoying a party. People call her the karaoke queen, I think. So it appears she's well liked, at least within the current regime. Another interesting thing that I found out about again, it was in 2018. She had meningitis. And required hospital treatment for that as well. So she's had some first-hand experience of needing hospital care and care within the NHS, which I think can only be a positive that she's used the service that she is now in charge of. She also made some comments that she wasn't quite sort of picked up or diagnosed straight away as well. So I think that's interesting that she's had a complicated journey, I guess, through that illness. I don't know any other details about that other than what I've seen in the Telegraph, on those issues. So I think we've got. I will show the picture. So this is from Sky News, just so that we know who we are talking about. So here she is in. Two guises really. So I think this is when people talk about her being quite social and enjoying a party. Can smoke the odd cigar, drink a bit of whiskey, and then this is her in her more daytime garb, I guess, in government. So an interesting character, I think, reminiscent in some ways perhaps of Ken Clarke, who was one of our local MPs. He was Minister for Health. I remember people talking about him drinking whiskey and smoking cigars, and he actually ended up being quite a well-loved local politician, actually, and grandfather of the House, the oldest MP serving at one point. So that's her really. So is there any other things to look at? Or so she went to Catholic school, and I gather she's still a practicing Catholic. People may want to attach some importance to that, they may not. I think she's voted against sort of pro-abortion policy. She's not anti-abortion, but I think in terms of Northern Ireland, I've probably got some of that wrong, and also I think against gay marriage back when there were votes on that as well. But I believe she said that she's she's a Catholic. That's very important to her, but it doesn't affect her.
Yeah.
It's not directly informing her voting. Anything jump out at you with regards to her background? That was quite a factual run through, so hopefully I was up to speed in the facts about her.
I mean, it shows a person that has limited general experience in terms of the healthcare system, in terms of organisation of it. So she's not really had any previous roles in terms of health itself, which is not unexpected. You know, quite a few of the previous health ministers have not necessarily been directly involved in health prior to becoming Secretary of State for Health. So people like Sajid Javid and Steve Barclay. Actually, Steve Barclay was probably, but that's not necessarily a trend we see. She has been critical in the past of the NHS type of care, and so there are some articles in the past that talk about how her perception is and expectations of the healthcare system. Like you say, that may result back to her experience when she had meningitis and stuff. May not do. So I think that's just more commentary than anything else. I know that there is unfortunately some fairly unpleasant social media stuff out there about that she's not the virtue of what the NHS should be. If you compare to some of our previous health ministers, they've generally been quite fit, active individuals that generally have clean living. Matt Hancock comes to mind in particular, and that he was well known for being very fitness minded and stuff. And Therese is definitely the opposite of that in terms of the public image that she has. Okay, each to their own decision in my view, but I think there is questions that will be raised about policy decisions you then make based on those practicing what you preach kind of thing. So it's important to recognise that is an implication and a visual thing that people I think will take on board.
Absolutely. I mean, I think it really remains to be seen what she does in the job. Essentially, there's an opportunity, I think, for someone to come in, not necessarily knowing a great deal, about health, the structure of the NHS, or even the reality of the challenges faced. But if that person is a good listener, if they're a good operator, if they can listen and get the right things done, and there's always an opportunity for people to do that, then she could do very well. It sounds like she is well connected with the Prime Minister, Liz Truss, and has good connection there. I know Liz Truss is close to the Chancellor. I don't know if Therese is, but there's an opportunity for someone to get to really understand the challenges of the health service in the UK, who has access to decision makers at number 10 and number 11, and potentially do some good. But it just remains to be seen, whether she will listen, whether she has those skills, whether she will do that, or whether we get somebody who follows more just the line of number 10 or an established party line on health. So we will
I think you're right. We're in early days. There is some, glimmers of positivity. So she's already been around to see a general practice, for example, which is something that some of her predecessors were really bad at doing. In particular, Sajid Javid was notorious for not really having visited any general practice at all during his time as Secretary of State for Care. In fact, seemed to almost avoid it. And within the first 2 weeks, she's already been to see a general practice with one of her MPs. I can't remember which one off the top of my head, unfortunately. So, there is some elements of that kind of communication. She's had meetings already with Amanda Pritchard from NHS England, and that seemed to have been what looks like a positive meeting, at least on very much on the social media posts and things. She has already outlined her plan within a couple of weeks of what, needs to change within NHS. Yes, you could, and we talked about this in great detail in our previous episode about why that might have been and the detail of that particular plan itself. But there is some action there, which I think is important to take at this early stage. And part of that has absolutely been delayed by, the passing of Queen Elizabeth and stuff, which basically stopped everything from happening for, a good week or so. So, there is some change happening, and it'd be interesting to see how this develops moving forward and how much Therese listens to the grassroots in particular. On that side, it's not been as positive. We know that both the BMA and the RCGP in particular have been very outspoken in the fact that they have not been given time to speak to Therese at all about some of her plans before she published them. So a mixed bag, definitely at this early stage in terms of her journey as our Secretary of State for Health and Social Care.
Yeah, and I can probably leave you with 3 last pieces of information.
Let's go for it, Andy.
So in response to her lifestyle, she's told LBC in an interview with Nick Ferrari there that she appreciates that I may not be quite the role model, but that her own experiences as an NHS patient will see her make them the priorities. I think she's referring to NHS patients being the priority. So she sort of acknowledged that. And finally, her preferred karaoke songs are apparently Don't Stop Me Now by Queen and Sweet Caroline.
Okay.
There we go.
And on that note, bid you adieu. As always, we're here to help tech enhance your primary care and learning. Catch you in the next episode.